Okay, so for the second last point, which we were just going to touch on, there was actually a lady who sent through a very honest question with a little bit about what she is currently experiencing. So I did think this was a good one to touch on. She says, "Hi Lissy, I've never had painful intercourse before, but since reaching this menopause stage, it feels pretty tender and sore all of the time when we try. Sometimes we can't continue, and this is putting a little bit of stress on my relationship, and I'd just like to know if there's something I can do about it." So first of all, yes, there's definitely something we can do about it, and you are doing the right thing by talking to either a women's health physio or your GP or your gynecologist about it. What a lot of us might be aware that there are typical changes which can occur for a lot of females during menopause and during those perimenopause stages. It's important to understand that one of the key reasons why this can occur is with that decline in estrogen, it is going to have an effect on how our vaginal tissues, our muscles, that vaginal mucosa can feel. So quite often, the vaginal mucosa can become a little bit more sensitive. The muscles, it can feel a little bit more dry, is quite a common symptom described. And then the muscles themselves can actually become a little bit more lax and almost weaker, as we would say. And other changes which a lot of ladies can actually describe going into this sort of perimenopause or this menopause where there might be that estrogen deficiency, we can also see changes in bladder. So our bladder itself, it usually has a nice level of stretch so that we can kind of send those little nerve messages to our spinal cord up to our brain saying, yep, I'm feeling like I need to go to the toilet soon. I'm going to find a suitable time to empty my bladder. But sometimes what happens is with that lack of estrogen, we start to lose a little bit of that kind of stretch and that elasticity around the connective tissue in the bladder, in the smooth muscle, So what can happen is, because it's a little bit more rigid, when our bladder is trying to expand, if it doesn't have as much movement and as much sort of stretch around it, it can send those little messages to our brain, and it can cause symptoms like increased urgency, or sometimes we feel like we're going to the toilet a little bit more. That's something else which I think a lot of ladies present to us as pelvic floor physios within clinic. But the biggest thing is that it has to be individualized to yourself, because some ladies will experience certain changes, and for example, maybe under the guidance of your gynecologist or your GP, a topical estrogen cream is prescribed to help the vaginal mucosa, to help that local tissue. And then there will also be other types of treatment which specialist doctors such as your gynecologist or your GP may recommend based on your individual symptoms. So I think the biggest thing to highlight out of all of these kind of themes of questions we've had is that if you experience any changes in your bladder, in your bowel, in your pelvic floor health, in your sexual health, it really is worth talking to someone about it, because what we do tend to find is the longer we leave these undiscussed topics, by the time you do potentially present to a pelvic floor physio, if you think about how long, for example, you've been experiencing pain, it's going to take time to retrain the nervous system, retrain the muscles, and then re-engage with those types of activities such as intimacy or certain types of exercise at the gym, which maybe we've been avoiding for a period. So like anything with our health, female health is the center of a lot of how confident we are in our day-to-day, in terms of it can dictate what type of activities we do, how we engage with other people, how we engage in our relationships. So it really is something that if you are noticing changes in your bladder, your bowel, those things we've discussed today, and just general pain, that's actually another one which we haven't really touched on, but if general pelvic pain, please just chat to one of us and send us through your questions, give us a call. We're always here to help as much as we can.